Hi, I'm Kat. I'm the nurse practitioner at Midwest Allergy Sinus Asthma in Normal, Illinois. Today we're going to talk about inhalers. We're going to focus on asthma, although there are a great deal of inhalers for COPD and asthma as well. So there are a lot of different types of inhalers. They range from a traditional, what patients may call a puffer for their rescue inhaler, to dry powders, to breath-actuated inhalers. So while there are a multitude of different types of inhalers, it's important to ask your provider regarding specific technique, as new inhalers are coming to the market every day. We have this nice chart from the Asthma Network that talks about different types of inhalers, what each one is used for. So we have that we can show patients. Sometimes they come in and they're confused about which inhaler they use, whether it's a red or orange. We can just show them this chart, and a lot of times that's helpful to figure out exactly what you're on. So today we're going to start focusing on technique. We'll start with a rescue inhaler, what a patient would call their puffer. One of the most important things to do is make sure that you get your timing right, and that involves breathing out completely and emptying your lungs so that we can go ahead and coat them completely when you take a breath in. So Dana here is going to demonstrate. So initially you're going to take the lid off. You're going to make sure that it's ready. You're going to take a deep breath in, and then you're going to blow it all out. Then once that's out, you can put your inhaler in your mouth, click, and breathe. Hold your breath, preferably around 6 seconds, and then let it out. So those are your traditional rescue inhalers that we use for asthma. First, we'll start with a metered dose inhaler. These can be used for rescue, and there are also ones that are inhaled corticosteroids, which are used every day for maintenance. So we're going to start with those. Dana's going to show us how to do those. Some of them need to be, you need to shake some of them. Initially, for the first time, you'll need to prime them to make sure that they're ready to use. So when you're ready to use it, you're going to make sure that you take a nice deep breath in, and then breathe all the air out that you can. And then put it in your mouth, puff, deep breath in, and then hold it for approximately 6 seconds, and then breathe it out. So those are the metered dose inhalers. We also have breath-actuated dry powder inhalers, which are similar, but you don't have to be as concerned with the timing. It's easier sometimes for people to not have to push and take a deep breath and try and get the timing together for that. It's basically the same technique where you breathe all your air out, take a nice deep breath, hold it, and then breathe out. So we started with those. We also have some other dry powdered inhalers. Same concept. I'm not going to necessarily make Dana do it again, but she can. Okay, and another one that is on the market is a Respimat. That's different in that it turns and clicks. Once you've turned and clicked it, that's when you know it's ready to dose. And then there is a button that you push that then releases the medication. Sometimes this is easier, even though there's a button to push, it's easier to get your timing down with that versus one of the metered dose inhalers where you have to push a little bit harder. Thank you for watching. Hopefully this has been educational, and we helped to give you some instructions on the best way to use your asthma medications and your inhalers to make sure that you're getting the medication properly.